Hi everyone, this is Dr. Labib. Next to me is Dr. Yusuf. Welcome to Reframe Your Health podcast. Today we're going to talk about the gut. I'm sure a lot of you recently watched the Netflix documentary, Hack Your Health, The Secrets of the Gut. And we got a lot of questions from our patients related to the gut and how it relates to health and especially women's health. So we decided, Yusuf and I, to talk about the gut health and the controversies around it in relation to women and women's health and many of their diseases in pregnancy and menopause. So where should we start?
Well, Labib, the first question that we should ask is why is gut health important in women's health? And unfortunately, for the longest time, gut health has been looked over, has not been taken seriously. It actually has been treated as just a system by itself, and it's not linked to the other organs. Whereas more and more research has been coming out detailing how the gut has been linked to other organ systems and your entire body as a whole. A lot of talk lately about the gut-brain connection and gut immune system connection. And basically, when we start thinking of the gut-brain connection and how your gut can affect your brain, and basically your brain is your master organ, it controls everything in your body, we start asking questions as how is your gut affecting your brain and how is that affecting your body as a whole, your hormone production.
Yeah, I mean, the gut, like you said, the gut produces hormones. There's a lot of nerve endings, so this is where the connection is. When you eat and the food is digested and you produce a lot of gases, right? So some of these gases, we think about them being harmful or bad, and actually some of them are really good because they really make the system function better, your mitochondria to function better. Of course, if there's an excess of gas and some other types of gas like H2S and other ones, they can be annoying and they can be harmful. But in general, gas is important to help the function, as well as the bacteria that's in there that we're going to talk about, which are some of them are good, some of them are bad. But all these hormones that come out from our gut can affect our brain, how we think, our mood, our energy. So the gut is a huge organ, and it has a lot of nerve endings. It produces a lot of hormones and immune. So it's kind of the first line defense. Once we eat something, it defends our body like our skin does. So it's a great organ.
As OBGYNs, we never look at the gut. We treat the reproductive organs, and we never really look at the gut. And it's such a shame because it's such an important connection between the gut, brain, and the reproductive organs and reproductive system that it should not be overlooked.
They're right next to each other.
Correct.
There have to be connections, and like you said, it's nice that now we are finding out that there is a connection, and we have to always think about whether the problem is in the reproductive or in the GI or in the gut, or maybe
both.
Both, exactly.
Both.
So what are some conditions that you see both changes?
We clearly know that women are more prone for, or more likely have higher odds of having autoimmune disorders. And the gut is clearly linked to autoimmune disorders. Autoimmune disorders like rheumatoid arthritis, lupus, and the next topic would be hormonal imbalance. Hormonal imbalance, which is something more common in women, it's clearly linked to the gut health, and we're going to tell you a little bit more about gut dysbiosis and what is gut dysbiosis and how can that affect your hormones. So let's just say first, what is gut dysbiosis?
Just before saying that, so when you were saying that the gut is related to these issues, because there's a problem in the gut. So what basically happens, a lot of the toxins that we inhale, a lot of the food that's really not supposed to be there, processed food and stuff that have a lot of chemicals in them, form this reaction, and this can lead to the problem, the hormones and the nerves, and will affect all the organs, cause autoimmune diseases such as thyroid problems, lupus, SLE. So I think the inflammation that starts in the gut, and now we'll talk why it happens, but this inflammation is like as if whenever you injure your skin, okay, if you have like a splinter that gets into your skin, you notice later on that it becomes red and painful. So same thing happens in your gut. You get this inflammation and all these immune cells are ready to attack. And once this happens, it becomes very leaky, it becomes very painful, gassy, gassy, bloating, all these symptoms, but it can affect the function and it can lead to hormone imbalance or autoimmune diseases. So the microbiome, what's the role of the microbiome in that process?
So the role of the microbiome, we have trillions and trillions of bacteria that are in our guts. Some of them are bad and some of them are good. Our body tries the best to keep a balance between good and bad bacteria. No overgrowth of the bad bacteria over the good bacteria. Anytime there is overgrowth of the bad bacteria, the harmful bacteria, then we get something called dysbiosis, the imbalance in our bacteria that's in the...
How does this happen? Why does it happen?
Why does this happen? Multiple things can cause this to happen. But a lot of times it's what we are doing to our body. A lot of times is what we're consuming, what we're eating, what we're drinking, when we're eating, when we're drinking, if we're sleeping enough or we're not, if we have conditions like cancer, if you have conditions like celiac disease, if you have conditions like malabsorption, any chronic condition can affect how these bacteria are imbalanced. Sometimes unnecessary use of antibiotics can cause this imbalance in the bacteria.
So it is the imbalance and also actually the harmony, so how these bacteria communicate with each other, the good and the bad bacteria, and whenever there's a problem in their communication or their amount or their balance, this is where the problems happen. And yes, we do call it leaky gut, but if you go back to the medical literature, there is no real diagnosis of a leaky gut, but it's basically an inflammation of the gut. Maybe, the word leaky is not very popular and not everybody's using it, but there is something going on right there. So whatever you call it, there's a problem in the bacteria. There's also something called SIBO, an overgrowth of bacteria versus, dysbiosis. I think, people always confuse which one is which, but the idea is the same. There's different ways of diagnosing those, but the idea is the same. You're having your army is not in balance. Your army is fighting among each other instead of protecting you, and you're getting those diseases.
It's very important to note that a woman's body is completely different than a man's body. The bacteria that is present in the woman GI system, the good and the bad, they're different from that of man. And unfortunately, again, literature, all the studies that have been done, they have focused mostly on men's health. So we don't have a lot of insights, and luckily there's more and more things coming out. But there's clear evidence that in certain conditions, the gut bacteria of a healthy woman differs from someone who's sick. And we can talk about conditions like polycystic ovarian syndrome, PCOS. We can talk about vaginosis, when there's recurrent infections in the vagina, endometriosis, menopause, a lot of GYN cancers, gynecologic cancers. The gut microbiome is not the same as in someone who's healthy. Is it the cancer that's causing it? Is it the treatment that's causing it? But this is something that we should be aware of, because correcting that, trying to fix the imbalance can maybe help with the outcome of the treatment, can help restore that balance.
And one important thing, like you said, women's microbiome is different than the men, but also it depends on where you live in the world too. So our microbiome here is different than a microbiome of a person living somewhere else. So this also plays an important role in how we treat the problem. And also one important thing you spoke about women. So other than the microbiome in pregnancy, which is also another very important, maybe we should dedicate a whole episode about that. But throughout the cycle, it changes sometimes. And the most important thing, women do have vaginas. So there's also the microbiome, of the vaginal microbiome, which plays a role. So the microbiome starts in the oral cavity, which now there's a lot of studies about the oral microbiome, vaginal microbiome, and because they're all connected. So yeah, there might be a relation, like Dr. Yusuf was saying, between infections, recurrent vaginal infection, and your gut microbiome. And I remember very clearly, years ago, I had patients telling me that I'm having recurrent yeast infections. It can be related to my gut, and I would completely disregard this. And now looking back, I was so wrong. That maybe we should have put these patients on like anti-candidal diets and concentrate more on their gut. I was like, no, it can be your gut. Well, now we know it is, and it could be related. And then pregnancy, like I said, the microbiome changes. What about menopause?
With menopause, just because of the changes in the hormones, there's a shift in the types of bacteria in the gut, whether that's an effect of the drop in hormones or vice versa, or there's like it's a bidirectional highway. We don't know. I believe that it's a bidirectional highway where the drop in hormones changes it, and then the change causes further change in how the levels of the hormones in the blood and in the body are. So menopause is another thing that should not be disregarded as to evaluating for the gut health and supplementing. Now, the biggest question that we need to ask is, how do we make sure we keep this good balance in our bacteria?
I think first we have to also talk about how do you say you have an imbalance to start with. What are some of the tests, and then how do you keep it? How do you know? Like there are stool testing that it can be done that have that look at the thousands of bacteria and their ratios, that looks at some inflammatory markers in the bowel to see if there's any leakiness or inflammation. So there's multiple tests on the market that can be used depending on your symptoms, but most of them do this work on the same idea of looking at the bacteria. So this is how you diagnose it. Plus, of course, what the patient or what are you feeling? This is very important. And digging into your lifestyle, what are you eating? How are you sleeping? All this will help us. How much antibiotics you took when you were a kid or before? This will help us know if there can be a gut problem. And of course, we can make the diagnosis even stronger with the test. So let's say now a woman, she's 35 years old and 35 years young, I would say, and she has these symptoms of irritable bowel or bloating and hormonal imbalance. And we did the test, and she has dysbiosis. So what can we do to fix this, and how long does it take to fix it?
The first thing I always tell people to do is they should stop adding harm to the existing harm. And how do we stop adding harm to we can start with very, very simple things. Starting from how you chew your food, and when do you eat your food, and what you eat. These are very, very simple, basic things. The healthiest tip would be to just listen to your body, listen to what your body's trying to tell you, and follow your body's rhythms. I love the fact that the body has a certain rhythm, and for some reason it coincides a lot with sunrise and sunset. A very important tip is to time your eating. Start your meals in the morning and try to finish your meals by sunset. Don't eat too late, because when you eat too late, you can be feeding your harmful bacteria. So that's the first kind of tip. The second tip is mindful eating. Chew your food really well before you swallow the food, because digestion really starts in the mouth. When you chew your food really well, it mixes well with the saliva gets secreted, and then this is the digestion starts.
My grandmother used to be the last to finish her meal, and I would ask her why, and she would say, because I chew my every bite like 40 times or 44 times. So it was kind of a joke for us that we should, but she was right. And I think a lot of these old wives' tales that we used to tell them, a lot of them have scientific basis based on their experience, and I think this is one of them. Chew your food well. You said the order also, or what to eat, and the order of the food, when to eat your veggies before your carbs or your proteins first. This is also how you get them into this. Correct. Is important. The timing is great. What else can we do?
The type of food. So in order to feed your healthy bacteria, you need prebiotics. And what are prebiotics? Prebiotics are essentially fibers. Cruciferous vegetables. The trick is to get as many different types of fibers as possible. You want to feed your good bacteria, and you want to avoid things that feed the negative bacteria, the bad bacteria. And bad bacteria loves ultra-processed food. And again, we all have sometimes eaten a processed meal or ultra-processed meat. It's okay. But when it becomes a recurrent thing, when it becomes something that somebody's doing it over and over again, ultra-processed food like frozen pizzas, frozen meals, the hot dogs that you buy from the shelf, these are foods that are
genetically
correct,
manipulated too. And you were talking about the food that we eat. Also, veggies. Okay, they're very nutritious to our body, but you don't want to eat them these veggies being sprayed with pesticides.
Yeah.
Then you will cause more harm.
Yeah.
So more toward organic food. Of course, when we say organic, a lot of people think, oh, organic food is only for rich people. If I don't, you can buy non-organic, but as long as you try to wash them as much as possible, with baking soda, with vinegar, multiple times, then this will decrease the load of pesticides that are on our veggies, and it will make them even healthier.
Speaking of the organic and non-organic, I always try to get everything organic, but if I can't, I always try to get organic, the list that's on the environmental working group, the Dirty Dozen. There is something called the Dirty Dozen. These are the 12 foods that have heavy amounts of pesticides and harmful
but they're very nutritious. Yeah, I mean,
they are
strawberries and blackberries and spinach. So, but as long as you know they are, on the list, and you try to clean them as much as possible, try to get those in organic.
Correct.
And the rest non-organic, it's fine. So yeah, there's always ways around it. The EWG is a great resource. Of course, if you're talking about finding toxins and other things, there's a lot of applications that you can use also that will help you. But when it comes to food that's not packaged, I think trying to avoid the dirty and then getting organic out of those, and then the rest can be washed very, very well. So, like Dr. Yusuf is saying, if you can get the food from the garden itself all the way into your plate and not let it go through plastic packaging and all of this, it's great. Actually, today somebody sent me on Instagram a video about in the supermarkets you have all this mist that comes that they spray on the veggies to keep them wet. Apparently there are some chemicals that are being misted on these, not only water. So I don't know how true this is. Yeah, I mean I was shocked when I found out this. I have to look more into it to see if it's really true, or I always thought it's only water to keep them wet. So that's one thing. Okay, so we talked about food and about some of these tricks. What about prebiotics, probiotics? There's a lot of talk. Which ones are good? There's so many on the market.
There is so many on the market. I mean, obviously the conditions that we spoke about, right? PCOS, menopause, certain cancers, endometriosis. These patients will benefit from adding a probiotic to their daily routine, and because they have a dysbiosis in their gut. Now, prebiotics, I like to personally get them from natural fibers, and I like to get them from fermented food. This is my favorite type of prebiotic. I like fermented kimchi. I like fermented sauerkraut. I get those and I eat them as a snack.
Even fermented cucumbers, fermented
anything
pickles,
fermented.
like all these can be helpful. But you were talking about taking probiotics. The question that we always get, like, which one should I buy? How long should I take it? So I mean, there's no right answer, but like Dr. Yusuf is saying, they might benefit from it for a short period of time, but eventually it's not a fix. These are supplements at the end. So I think you have to work on what you're saying. Try to prevent the harm, try to replenish what you have.
Correct.
And rebalance your bacteria. And that way you might not eventually need probiotics or to be on them all your life.
But as a start with these conditions?
Yes. As a start, yes, there is evidence in the literature that it can help, with hormone imbalance, but it's not like a long-term thing that you'll be on as long as you fix the problem from its roots.
Correct.
Yes. So eating processed food and then taking probiotics will not help.
Yeah, you'll be wasting your money.
Exactly. So what about pregnancy? So in pregnancy, what happens to the microbiome? How important is it for the baby and for the mom?
So there is also evidence that in pregnancy, the gut microbiome is not the same as in someone who's not pregnant. And if there is a shift towards the harmful bacteria, this has been linked to several pregnancy complications. One of them is preeclampsia, which is high blood pressure in pregnancy. The question comes to be, do we supplement everybody with probiotics? There's really no answer to that. I think if somebody is already on a prebiotic, they can continue it. They can alternate between every 2 to 3 months. They can switch up to a new probiotic or take a break and then restart it, as long as you are trying to keep your already existing microbiome controlled and not producing insults. We all think of pregnancy as a time where you should nourish yourself, but a lot of people take that as an excuse to just
Start
eat
eating.
anything.
Yes. Eat for
and-
two, which is
And it shouldn't be the case, because what we consume during pregnancy, what a woman eats during pregnancy, is what is really nourishing that baby.
it's going to cause long-term problems to the mother. It's going to take her longer to recover.
Correct.
If she doesn't have a good microbiome. But yeah, physiologically it does change, and I'm sure it changes for a reason, to protect the baby. And then, of course, when the baby is delivered normally, the baby is exposed to all these microbiomes, and it's really good. It protects the baby's immune system, because when you're born, you don't have that many bacteria as you get older. So as you get older, it will increase more in number, and then of course when you get very older, then it will change too. But as a baby, you don't have a lot of microbiome. So by ingesting or being exposed to this, you will form more bacteria, good and bad bacteria, and that's why maybe babies that are born with C-section, they're not exposed to that part, might have more risks of asthma and other allergies and stuff. So there's actually studies where they do smearing, where they take vaginal flora and then smear it on the babies to see if this, makes a difference. Again, it's not only about smearing the baby; it's the whole process. And labor is a long time. The baby is exposed it for hours, not just seconds. So yeah, the microbiome in pregnancy also is very interesting. Can be linked to preterm labor, preeclampsia. Of course, this is not the reason, and but it can be playing a role in inflammation of the body that leads to those conditions. So very important to talk about the gut before pregnancy, in pregnancy, after pregnancy, in menopause, at every age across a woman's life.
The last question I wanted to raise is, what does the regular OBGYN do with this information? Where somebody might not want to be diving deep into the gut and the gut microbiome and etc. So, but you just make sure that you're aware. That's what I want to get to the patients and to the doctors who are listening to this.
Or just don't dismiss the patient like I did. Just say
Like
yes.
I did.
It could be a possibility. If you don't feel comfortable, they can be sent to someone who can do the the gut testing and help them. And then at the same time, the OBGYN can be working on the reproductive system, helping with treating an infection, for example, treating an ovarian cyst with surgery, or if they have endometriosis. But at the same time, working with someone, or if they are the same person, that's great. They can work on both systems, but that will give a better and a stronger result for the patient.
So don't dismiss it. Also raise awareness to the patient. If they have these certain conditions that we touched upon, more than likely they will have some problem in their gut. Addressing that might help the outcome of the treatment. Addressing the gut with endometriosis is helpful with the outcome if the patient is getting surgery, if they're getting medical treatment. The same thing goes with PCOS when we're trying to regulate the cycle, trying to help with lowering testosterone, trying to help with insulin resistance. We also want to make sure that this gut microbiome is not worsening the insulin resistance, it's not worsening the estrogen metabolism, because half of the estrogen, I'm not going to say half, but a lot of the estrogen that gets produced by the body gets metabolized by the liver and then later in our intestines. So if there's a problem there, if
goes back to your
it might go back into your system.
Cause estrogen dominance and with all the problems that they can get.
That is correct.
So yeah, like Yusuf was saying, the hormones are in the gut, the nerves are in the gut. That's why we say I have the gut feeling. I mean, there's a feeling there. Or whenever you're anxious and there's something you're afraid of, you get stomach pains. When we used to have exams, this was something that would bother us a lot. So really the gut is amazing, and I think it plays a great role in everybody's health, but because we're gynecologists, we're talking more about women, because they also have oral as well as vaginal and the gut microbiome. So I don't know if you want to conclude, say something that like a message to everybody watching us, to what to do when they're not feeling well or they feel there's something wrong with their gut.
Well, if they have a gut feeling that something is wrong, check your gut. Check your gut. And there's clear conditions that we mentioned that definitely will have a problem in the gut balance or the gut bacteria balance. You don't necessarily need to do crazy testing when those conditions, but be aware of what you're eating, when you're eating, how you eat, and anytime you want to feed your gut something, think about, is this something feeding the good bacteria or is it feeding the bad bacteria?
Educating yourself, reading, seeing, I'm eating those type of food. Let me eliminate one or two and see how I feel. Do your own research about probiotics. Find providers that can help you. So you don't have to do $1 million workup. It can be just, trial and error, like the good old times, and then you will discover what's best for you and what makes you feel great.
You can always ask your grandma.
Yes, I mean, unfortunately, she's not here with us anymore. But of course, you can always ask. Experienced people. They have, seen it all and tried it all. But of course, I think the food during our grandparents' time was different than now.
The summary of this episode would be that gut health is important. There's a connection between the gut and the brain controls everything. There are certain conditions that women go through that are specifically linked to problems in the gut microbiome. Being on the watch for these problems and your gut is extremely important, and starting to fix it by eating at the right time, avoiding ultra-processed food, eating healthy foods, eating prebiotics, taking probiotics, chewing your food really well. And
I think just be patient.
That's a great start.
The change will not happen overnight. It takes time for the microbiome to change completely or to, rebalance itself. It takes time. So be patient. Be curious about why your symptoms are happening. I think that's the message Dr. Youssef and I wanna give you today. I hope everybody enjoyed what we talked about. Please, if you have any questions or comments, we are open to hear everything about the episode. So leave the messages or the comments in the comment section. Like our videos if you like them, and hopefully we will be able to see you in a next episode where we'll be talking about something you guys will send us through the messaging system or through comments, and we'll see you back next episode.
We really hope that you enjoyed this. This was brief. This did not go too deep into the topic. We wanted to keep it short so
maybe we'll get questions more specific and we can do episodes about every
a deeper dive. And we want to keep people entertained. We don't want to bore them with a lot of information. So thank you for watching this. We're looking forward for your comments, and we'll see you in the next episode.
See you next episode.